So what can you expect from the first consultation? Whether the doctor nurse sees you, they will take a history from you. I think it's very important to understand why you want to be on a weight loss drug, what you're trying to achieve. Is that realistic? What sort of time frame you think of taking it? You take a history, we'll examine you, do your height and weight so we can understand what your BMI is, to see if it complies with our prescribing policy. But also, we will do some blood tests. The reason for that is the main side effects from taking these drugs, remember they're for diabetes, they lower your blood sugar. Not dramatically, but enough that for the first few weeks you might feel more tired or more dizzy, and that is just until your body gets used to the lower blood sugar. They also can cause constipation, so it's important to think about how you're going to manage that, whether it be through taking some Movicol or drinking lots of fluids, eating more vegetables and fruits. The most common, which is pretty unusual, side effect that we worry about is whether your pancreas can become inflamed as a result of the medication. So routinely we will do a baseline HbA1c, see what your average blood sugar is. We'll do the urine electrolytes, but we'll also do an amylase. Over the last 2 years, there are 3 or 4 occasions where I've needed to either stop or reduce the dose because someone's pancreas has become inflamed. We do that result every 3 months. I think that way you can be monitored properly. At the end of the first month of treatment, we would expect you to call us, not to come in, but phone, check whether any unacceptable side effects, check how you're doing, check whether you need to increase the dose. Often people that wish to lose weight slowly and achieve a weight that might be maintainable, we do not increase the dose past the first or second dose, and yet they achieve their targets. We've had very good success over the last 2 years where people have lost up to 25% of their body weight, which is really quite dramatic and life-changing. You will have always seen people on Instagram or on television or in the films where they've lost too much weight. And I think it's very important to keep an eye on yourself in the mirror and make sure that we don't overdo it. This is about doing something that improves your health as well as improves your looks. So our aim is to improve your long-term health, manage your cholesterol, manage your blood sugar, give you a better outlook going forward. But if your aim is around the cosmetic look, it's important that we don't go too far. And that's one of the reasons we check people. None of our patients so far have had over thin faces or loss of muscle bulk, which is really very important.